This is the slide that I just was amazed when I saw it. And this looks at the age-adjusted confirmed COVID hospitalizations by race and ethnicity between March 2020, when we first knew this was in the US, to June, this past June. And so we've been looking at this and anticipating getting to tonight, because we've talked about the non-Hispanic or First Nations or American Indians. This is per 100,000 population. This is the non-Hispanic Blacks. This is African Americans. This is the Hispanic or Latinos. And look at these. All of these are over 1,000 per 100,000 of the US population, in comparison to the white population, which is the majority of people, but certainly not the majority per capita of hospitalizations and Asians. And so this really represents the disparity that we've been trying to help to illuminate and ask, why is that? And is that what you saw in the clinics?
100%. This is a reality. This is not, I often get asked, even from the very beginning of the pandemic, I get frequently asked that what we saw on the news, was that all true, or was that, just glorified? Was it sensationalized because of, the media? And I say, absolutely not. These are real people. These are real lives. And this is the reality. This is what we see. This is what we continue to see. And again, even now, if we fast forward to where we have a vaccine, we're seeing the people that are coming in are again in the communities who are most affected, most marginalized, who have not yet been vaccinated. Why? Because,
you need people coming in for COVID now, who are being hospitalized for COVID now. You see the same brown and black faces because they're not vaccinated.
Exactly. It's the same trend that's been there for the last, 18 months. It's continuing because it's the structural racism that is there in healthcare. And why are these things there? We talked a little bit about, not having the privilege of working from home. Well, we have to really look at, how is the system set up? We know that their marginalized communities are sort of set up to live in certain areas. And we know that those areas, people don't have access to large healthcare systems in those areas. They don't have access to basic, these people may be exposed to more pollution in these areas. There's more crowding. We know that there are many, many social determinants of health which predispose people to already have underlying medical conditions, whether it be asthma, whether it be diabetes, from having a lack of, access to nutritious foods and things of that nature. And so, these kind of factors really build you up to have these underlying medical conditions. And then we're talking about the lack of access to healthcare. So now you have underlying medical conditions that go unchecked. So, you don't
over a period of time.
Over a period of time. So you've had years now of diabetes that is being poorly managed because you don't have the privilege of having a large health center in walking distance from your house where you can go, or have the privilege of, having a spouse who can babysit, or have a babysitter. You might be a single parent who's working, who has to continue to work and cannot miss work, lose, a day's pay, or lose your job because then, you lose your house. There's so many confounding factors. Public transportation, taking several buses to make it to an appointment, only to realize that, well, the other bus that you had to take is running late. You show up late to your appointment, your appointment's canceled because you're 15 minutes late, you're 30 minutes late. So what does this do? This deters you from continuing on this path, because there's no, there's no ease in this. There's no resources. There's no support system for you to really motivate you to continue to take care of your health and make your health a priority, because it's simply just not easy. It's made very difficult for you. So that in turn leads you to all these underlying medical conditions that go unchecked, that are, essentially not being managed well. And those medical conditions specifically put you at risk of being, a severe COVID patient. So we already have people that are more at risk because of the nature of their work, because of the nature of, where society has put them, having to have a multi-generational household and not having the privilege of socially distancing from family members because, you're sharing living space. You have one bathroom, you're telling people, oh, if you feel sick, stay in a separate bedroom, separate bathroom. I mean, that's not a reality. This is not a reality for so many people. And so, the messaging was wrong to begin with, because you're not taking into account the people that don't have that luxury, and the people that are being most impacted by this. So you have all these things that are setting you up to really be that person who is going to be most at risk because you're going to have the most exposure, and tie that into you have the most underlying risk factors to really have a poor outcome. So then you get hospitalized, you have a really bad course, and you don't make it. And this is the reality time and time again, what I have seen in all my patients. You know, I cannot tell you during the first wave and even during our third wave. The second wave was a little bit smaller last summer, but you know, majority of the patients that were coming in were younger. Unfortunately, initially we had a lot of, you know, elderly patients that did come in, but after that, when we were trying to keep the nursing homes, you know, isolated and protecting our elderly, then it was just the wave of, you know, younger people with underlying medical conditions that didn't even know, half of them would not even know that they had diabetes, you know, because again, when was the last time they went to a physician? And again, this was the cycle, this vicious cycle that just keeps going, and the lack of resources, not just healthcare resources, but the lack of educational resources for these communities. Who is telling them, giving them the information that this is what you need to do to protect yourself from COVID? You know, that in itself was not there.
Yeah, those trusted people, those people who are informed, and that's what we're hoping tonight people will realize that they are part of that solution.